is titled Preparing to Sell: Strategies for Maximizing Your Behavioral Health Business Value. Very excited with the guests that we've had, that we have on with us today. A couple of friends of mine, mentors and colleagues in the industry. Jonathan DiCarlo is the CEO of C4 Consulting, and Dr. Jerry Vaccaro is one of the operating board members of Sun Healthcare Capital. And we wanted to bring this group of people together today to have a meaningful conversation about not only the mergers and acquisitions activities and how the nature of your business operations kind of roll up into positioning yourself well in regards to a merger and acquisition, but what you can continue to do from an ongoing basis to really support the value and substantiate the way that you're able to demonstrate quality of care, among other important factors when it comes to some sort of capitalization event. So before we get into the conversation, I'd like for each of our panelists to briefly share a little bit about themselves and their background, the organization that they're working with, maybe just the place that they're coming from in entering to this conversation. And we'll start with you, Jonathan.
Certainly. Well, thank you, Parker and Dr. Vaccaro, for allowing me to join you today. My name is Jonathan DiCarlo, Chief Executive Officer of C4 Consulting, division of C4 Recovery Foundation. So we are a behavioral health consulting firm that specializes in really being the provider's provider, certainly helping businesses optimize, enhance their client engagement and really use data analytic driven processes to improve the impacts of their performance and the communities that they serve. I have the pleasure of serving as Chief Executive Officer for C4 for the past 6 years, and was prior a senior consultant in the team. And I've spent the last almost 29 years in the behavioral health field, starting out in the clinical roles and getting into administration and ownership over time. Certainly have had a lot of experiences in the merger and acquisition process, both in being part of teams being acquired, helping with sales, and certainly through the work of our firm in guiding preparation, diligence, and execution of sell-side and buy-side acquisitions in the space, in substance use, mental health, ABA, foster care, senior living, the widest interpretation of behavioral health. So really looking forward to our discussion and grateful to be here today.
Thanks, Jonathan. And a little background on my relationship with Jonathan. He and I have known each other since back when I was the director of operations at North Star Transitions in Boulder, Colorado. Jonathan has done a lot of incredible work in our industry in the state of Colorado on a nationwide basis. And so we're really proud to have him as part of the conversation. And I'll kick it over to you, Dr. Vaccaro, if you'd like to give us a brief introduction about yourself and
Sure.
kind of where you're coming from in terms of your current activity in the space and where you've been in the past and what's getting you excited about this conversation as well.
Sure. Happy to do that. And thanks for inviting me today, Parker and team. And Jonathan, pleasure to be on a panel with you. So as you can see from the slide here, I'm a healthcare executive, have been such for more years than I care to remember. I know I look very young, but I'm not. And basically, I'm a psychiatrist by training, and I've led a variety of organizations in first the academic sector and then the managed care sector. As you see here, as CEO of United Behavioral Health, Pacific Care Behavioral Health, and APS. I was at UCLA for a lot of years, mainly doing health services research. And now, for the last, I guess, 8 or so years, I've been back on the operations side. So working with provider organizations, which is how Parker and I met in the middle of COVID. We can tell stories about that someday. And when I was at All Points North as the president there, and I've run other very large systems, Prospect Integrated Behavioral Health, which is or was a 24 site around the country, 750 bed plus about 700 PHP IOP beds. And now, over the last 5 years, I've really redirected my attention and have partnered up with private equity groups, looking at it. My role there at Sun Healthcare Capital and a couple of others is to serve as the operating partner, which translated means that when an equity group is or whomever is looking at buying a company, I get in, I look at the operations, kick the tires, and sort of give it thumbs up, thumbs down based on the operations I see. And then when we buy it, so my current group has bought 4 or 5 companies. When we buy it, my role is to oversee the companies to make sure their operating performance continues, and at times to parachute in whatever role is needed. So I'm at the stage of my career where titles don't mean anything to me. I just love the work. So Parker, to your question about what turns me on is, I think we're at a great stage in behavioral health where finally it's not gone, that's for sure, but stigma is diminishing in its dominance of our area, however you look at it. So whether it's public perception and people talking openly about their behavioral health challenges, or looking at public policy, which has changed, funding, all those things have changed and have come together, I think, to put the spotlight on it, which can be good or bad, but put the spotlight on behavioral health and cause us all to do things differently, better, and try to change the healthcare world. So that's what gets me going, Parker.
Awesome. Well, we're excited to have you here. Excited to dive a little bit deeper. Definitely, feel the same way in terms of the industry kind of reshuffling of the deck and a lot of different things changing that impact mergers and acquisitions, but every different stakeholder group in the industry. So just a brief bit on myself. I'm the founder, CEO of Simplifiance. My number one passion is quality and safety of care. I believe that everybody that takes the leap of faith and pursues a journey of healing deserves to be treated with the utmost safety and also with quality care that is measurable through data and different modalities of care that can really be looked at from an objective viewpoint in terms of progress. So what we have here today with our group is, Jonathan and his group is working very diligently with a lot of different companies, not only through the process of a merger and acquisition, but long before an event like that happens. And so, Jonathan and his teams are doing a lot of incredible work in preparing businesses to be ready for some sort of liquidity event. And then Dr. Vaccaro on the other side is helping to not only vet new opportunities for capital groups that are seeking to either expand or to merge or to acquire. So we've got some really cool perspectives. And then Simplifiance is a solution that organizations use to maintain a level of safety, quality, compliance, and operational excellence that we can tangibly speak to increasing the value of the business operations that successfully implement our tools. So the very first question that I'm going to ask is for you, Jonathan, just to kind of provide an overview of, as you see it, the larger space of mergers and acquisitions in behavioral healthcare. At some of the recent conferences, TCIV, Behavioral Healthcare Business Invest in Chicago, we've heard a little bit about how M&A activity is down, but it's not out. So if you could just share a little bit about what your perspective is about the current landscape of mergers and acquisitions in behavioral health, I think that would be a great starting point for us.
Certainly. And I think a lot of people who've gotten into the process of mergers and acquisitions in the last few years are seeing a bit of an anomaly in the macroeconomic sense. Typically and historically, there are 10 to 12-year cycles in behavioral health when it comes to mergers and acquisitions. So programs start and grow, they respond to community need, they grow, and then they get into that position where the founders either want to merge with other organizations to streamline processes, to keep their quality of care going and keep their revenue increasing in growth, or they want to exit. So in the macroeconomic sense, what people are seeing as a slowdown really is a course correction from some of the largest activity that was delayed through the pandemic experience. When we think back to 2021, there was a tremendous amount of activity happening. We had in this cycle, a cycle that should have closed really at the tail end of 2021, but we're experiencing what would have happened then today, ultimately. So it took a little bit of time for some of those investments to get deployed and for deal structures to be able to be finalized through the safety protocols and impacts to businesses and the unknowns. The expansion of telehealth and the rapid growth during the pandemic certainly opened up some opportunities. But I think in the macro sense, what we're seeing, while some people call it slowing or compression of the economics and the influences, is certainly present. What we're seeing, I think, is really course correction in the market. A lot of folks have been actively paying attention to, and frankly, investors really look at opportunities where there are higher reimbursements for revenue cycle opportunities and larger real estate plays. And so people are still very focused on residential, where the true growth has been in outpatient services and lower levels of care, as they're often referred to. And that isn't really slowing down, but the transaction numbers are getting course corrected. Certainly the cost of capital in the market today is different than it was a year ago, as everyone is feeling. The cost of some of the inputs, PPP loans and ERC credits are being paid for right now through our economy and course correcting. The bill comes due eventually. Well, the bill is getting paid today. And so it is slowing down some of the influences where, buyers and investors and those seeking to either make strategic acquisitions or, de novo opportunity into buying into behavioral health divisions and operations are being more conscious, much more thoughtful, and frankly, from the capital recruitment side of things, and I'm sure Dr. Vaccaro can speak to this. Lenders are being much more scrutinizing about what they're investing in. Where 3-4 years ago, there was much more of a liberal attitude because, frankly, the cost of capital was much less, by about 70% compared to today.
Yeah.
Some of those influences really are there, but I don't think it's necessarily a slowdown. I think it's a course correction. And that appeal towards residential and the idea that residential is really where the numbers and the EBITDA multiples that people say as business owners, I want to get an 8 to 10 multiple on my business. And the reality is that right now things are trading, and closing anywhere from, probably 6.5 to 8 would be a good average for certain size businesses, and those businesses that are generating, EBITDA numbers of say anywhere from, 500,000 to 2 million are trading anywhere from 4.5 to 6.5 multiple of EBITDA at this point. So when people talk about, deal size and structure and things slowing down, the larger acquisitions, one of the biggest healthcare acquisitions in the substance use and mental health space, with over $1 billion, in the price tag, traded 18 months ago. And that was a bit of an anomaly at the time as well, and took quite a bit of time to get there. So when people see those numbers and hear, experts say it's slowing down, I think it's really that correction.
Yeah, I appreciate that perspective, and I think what you're hitting on is the only constant in life, which is change, right? And it's course correction in some ways. Substance use treatment was especially attractive in the M&A, and now we see a lot more with mental health. And I do think that you bring up a good point that although some are indicating maybe that activity is down, maybe there's a consistent amount of that activity that's just not as publicized or as openly discussed in the larger markets. So I'll dovetail that into a question for you, Dr. Vaccaro. There's plenty of activity going on with your partners and in your network. So I'd love to hear your perspective on just kind of the overall M&A just landscape as you see it, and then dovetail that into some of the things that you are looking for with your partners and your colleagues when it comes down to evaluating a potential acquisition or a merger or a new investment, and some of what those indicators typically look like for you and the folks you work with.
Got it. Okay. Well, let me riff on that and course correct if I go astray, Parker. So you're right. So we've been very active. I would agree with Jonathan that this time period seems to be a course correction for me. One of the jokes on our side of the industry was that the bankers got either itchy fingers or stuff burning holes in their pockets during COVID. And we could talk a little bit about that, but there was pent up demand in that space during the pandemic. And when we exited or began to exit the pandemic, you saw that flurry of activity and some would say crazy prices, purchase prices. Some would say excessive. So, however you frame it, there was that period of time. And I think we're into a period of time, as Jonathan indicates now, where people are looking for deals. So there are groups like mine and others who see so behavioral health still is seen as a very attractive space. Why? Because it's growth oriented. There's a lot to be done to consolidate organizations to drive efficiencies. So for all those reasons, there remains very significant interest in the private equity world and community. What are we looking for? Well, so, we can drill into the weeds, Parker, if you'd like, but, at a general level, we look for three things, really: strategy, performance, and people, right? So do you have a good strategy that differentiates you from competitors? We can come back to that and talk about the details there, because everybody's got a strategy that says we're the best.
Yeah.
So I liken it to medical school, where I graduated at the top of my class in psychiatry, but so did everybody else who went into psychiatry. And everybody, when you talk to them, went to a top 5 medical school and graduated in the top 5% of their class. Well, that can't be true, obviously. And so when we look at strategy, we say, okay, let's put that aside. You've got relapse rates that are better than anybody else, and everybody loves you, and your customer sat surveys are fabulous. And so we let the smoke clear and look and say, really, are you different? Are you differentiated? Is that your strategy? Let's hear more about your strategy. And then we looked at performance, right? And so, we'll talk later about issues or mistakes people make. And one of them is the age-old don't overpromise, right? So don't come into something, I think, where Jonathan was suggesting, everybody wants a 10 multiple, right? And everybody thinks they're hugely profitable. And, it sounds silly to even say it, but so many people sort of massage their numbers to say, oh, yeah, we're growing at 30% a year and we're hugely profitable. And, usually we get to a point in those diligences where I say, what were you thinking, really? I mean, did you think we weren't going to look? So, a clean company that has a good strategy, good, solid key KPIs that they manage to, that we can vet and verify, that sets them apart. And then we're not a company or a group that, is like an Acadia, you're going to buy something, swallow it, and chew it up. We're looking for management teams. So the people, we're looking for good people in these companies, know what they're doing. And we typically like to work with a company where those people are going to stay around, so which isn't to say that, we don't take situations like we're looking at a couple of deals right now where the management team wants to leave, and so we structure that, figure it out, and we can do that as well. So if you have what you think is a really good strategy, I'd say get to Jonathan's group fast and crisp up your strategy, and you've got good performance metrics and you are performing, and you got some good people, then raise your hand, let groups like mine and other groups have a look and see what can be done. And I would argue, when you're looking at groups like ours, look for groups that really, especially if you're going to stay in the game or stay partly in the game, look for groups that are going to accelerate your growth and your progress, right? So it's one thing to go to a bank and get a loan, which, as you guys have said today, is kind of very difficult. And a loan, how it is. whether it's a mortgage or some other kind of loan, the person granting the loan only wants to make sure that they get their interest and that someday they get it all paid off, right? That's not who we are. And I'd argue if you go in with a private equity group, that's not who you should be looking for. You should be looking for somebody who's going to come in and really, from a strategic and operating point of view, accelerate what it is you're up to.
Yeah, that's really well said, Dr. Vaccaro. Absolutely, yeah. And I like just kind of in summary, those three key indicators. And I think everybody that's listening should really be taking notes around this three-leg stool of strategy, performance, and people. And I think I'll kick it back over shortly here to Jonathan to talk about some of the ways that C4 addresses these different areas of business. But yeah, you have to have a very clear strategy that differentiates you. You have to have performance. You have to have financial performance. You have to be able to have performed in the arena of contracting with payers, whether it be through value-based contracts with CMS, Center for Medicaid, Medicare Services, in the commercial payer space. And then what I was especially excited for you to bring up is this concept of people. So it is not, it is very clear at this point in time that the biggest, if not the biggest issues in our industry is being able to attract and retain talent and people. There's been a lot of folks during the last few years that have decided to leave the workforce. I don't blame any of them. It's a very difficult working environment to be in. You've seen the rise of some very large telehealth companies, which have attracted clinical and medical folks to an at-home working environment with a reasonable caseload where the billing and the documentation administration is less burdensome. And so, behavioral healthcare organizations have to be more creative than ever in attracting and retaining top people. And I think furthermore, as it relates to this discussion, being able to position your organization and your people and your culture in the way that you're engaging with them and the way that you're creating value for them. We live in a unique period in time where people have really started to evaluate their own quality of life, not only in relation to how much is coming in their paycheck, but what they're showing up for every day and experiencing with their peers and colleagues. So I'll try to translate that into a question for you, Jonathan, kind of on the thread of strategy, performance, and people. What are some of the ways, and if you're able to give any examples of ways that you've worked with organizations to kind of key in on refining the strategy, increasing the ability to perform, and then making sure that they're able to attract and retain, really quality people that can deliver?
Absolutely. And thank you for setting that up, because it really does come down to the first portion being engagement. So when we collaborate with a business to help them really optimize and to improve their process, it really does start with what's that initial client engagement look like. So the participant receiving care, the person served. But that also begs the question of that staff retention number and what is the culture of the organization. So how does that get communicated in branding all the way through the experience of admission? So looking at that marketing cycle all the way in, and then for each operation, really looking at each segment of the business and its services and dialing in and saying, what are those key performance indicators that you're using? And in preparation for sale, it's really being able to show, to Dr. Vaccaro's point, of showing incrementally, what are those increases and what was your strategy of change, and being able to have that documented, right? Really being able to say, we've had a year-over-year improvement in our conversion rates of leads to admissions. We've had client engagement and retention rates of these numbers improving year over year through improving our clinical processes. We've been able to demonstrate year over year renegotiations with our payer groups, right? And that's one of the areas certainly that we get involved with, is helping translate that clinical quality of care that's improving through measurement-based care into revenue cycle improvement, and being able to show consistent growth rather than, 1 year it's a 10% improvement, 1 year it's a 3% improvement. And the truth of the matter is that just by filing your renegotiation paperwork, most commercial payers will offer you 3 to 5% of an annual increase. but are they capable of giving and providing more? Well, you need the information and the strategy to be able to do that systemically, not just to get it once, but to get it every contract cycle, right? And to be able to have that systemically is a matter of quality assurance and compliance. So really helping organizations define and refine what is their strategy for growth internally with staff recruitment and retention, being able to lower, the number of AMA by therapist, as someone said to me yesterday, right? The people leaving the organization, as you identified, being able to show stronger engagement numbers and longer retention numbers of the person served. Diversification of services is certainly one. A lot of folks really struggle to understand, how do I, engage more services with the amount of staff that I have and maintain that clinical quality, integrity, growth, and then being able to have that all grounded by that healthy culture. I mean, the organization's health is the key to all of these things really functioning well. So when we talk about that, we're really looking at things like, what are succession planning? What is growth for staff in the organization? Strategically, what does that look like? Does everyone have a 3 to 5 year growth plan, in the organization? And what is that? Not just for the individual, but for the work groups, right? For the clinical department, for the operations, for the admissions department, for the marketing. And how is that interdependent? And how can you evidence that? And again, it's really measurement-based care is showing your work. So for a group like Dr. Vaccaro to come in, having all that data really driven, where everyone understands what it is, direct to their work, where someone like him can walk in and talk to a behavioral health technician and say, what's your strategy for growth? And they're able to articulate it. That's the work that we engage in throughout a system to really help, owners and operators and facilitators be able to express, to have the definitions, and to know and show the meaning of their work. And those organizations that invest in that see incredible returns within the growth of their business consistently over time. So not just following a trend that somebody read about in Business Insider, but really being intentional about taking on expanded service lines and saying, how are we going to maintain the quality throughout the entire process of a person served, by starting with our people within the organization and the culture.
Very nice. Yeah, I really appreciate, the point that you bring up about the diversification of services as well. In the last few years, we've seen a real birth of new modalities of care being more destigmatized, more widely accepted, and more regulatory rule adoption around things like ketamine-infused treatment, transcranial magnetic stimulation, TMS. And so it's interesting to see how the additional services that are being made available are being integrated into different models. And I don't know about you guys, but I've seen a lot more organizations grow in a successful way by continuously adding different types of modalities and treatments and service lines to be able to treat the whole person beyond maybe just one part of what they're experiencing on their journey. And so Dr. Vaccaro, you did invite us into the weeds, so I'm going to take us there next. So there's some more obvious kind of hierarching areas of the business that organizations kind of look to when they're thinking about projecting themselves out for a merger and acquisition. They can expect a quality of earnings review. They can expect a compliance review. They can expect a review of their team and maybe the tenure. What might be some of those kind of more granular details of, sets of data, or potentially even, tool chains of technology, different either third-party vendors or different types of ancillary services that you see either differentiating programs or setting them apart, or, what are some of the additional things that folks might not be thinking about that seem to catch you and the people that you work with and your attention?
Sure. Thanks. Yeah, I would agree. So comprehensive continuous care is key, right? So the old days of out of network, residential only, 60-day stay, swipe your credit card, we don't find very attractive, and most equity investors today will discount out of network, kind of stuff. So we want to look for the comprehensive play. And sometimes that means, people get scared when I say that. They say, well, I'm going to kill all my referrals from, my IOP in the local community, or whatever the case may be. And so you have to be surgical about this. So maybe it's through partnerships, formal partnerships, that you offer those services. So one, that's the comprehensive thing. Two, back to the people and the measurement altogether. I would say, and I'm a big fan of the culture, word, meaning, declaring a culture, not just sort of letting it happen. And one of the things I look for is whether there's a palpable culture in a company, driven by, in my view, achievement. And what does that mean? That means everybody in the company understands the mission, has measurable goals down to, every level of staff, up to every level of staff. And you look for them getting those, achievement checks, if you will, on a regular basis. So are people being managed to the things that Jonathan mentioned, kind of patient engagement, those kinds of things, AMA reduction, all those kind of normal
validated outcomes data. Yeah.
Say it again.
Like validated outcomes data.
There you go. So there's my next bugaboo, is clinical outcomes data, right? So everybody, to my earlier comment, graduated in the top 5%, of course, but very few people are, more today than a year or 2 years ago. Very few companies do that in any rigorous way, right? So I would urge anybody listening here to go out and partner up with a group that does clinical outcomes management, to include, sort of the analogies I always use are to general healthcare. You would never go to an internist to manage your diabetes or your high blood pressure who didn't check blood sugar, hemoglobin A1C, blood pressure, et cetera, and instead just said, I have this kind of feeling that you're doing well, so I'm going to adjust your medicines. You'd leave. But that's what we do in behavioral health. It's like you sit in a room with some, the old style, the way I was trained. You sit in a room, you get the gestalt, favorite word. You get the gestalt of how somebody's doing, and and this and that, and you up titrate, you down titrate, or you modify your treatment accordingly. That's baloney. You need to concretely measure outcomes, to include relapse and recidivism. And by that, I don't mean calling up. So when we go in and we say, let me see your metrics, and somebody says, well, we have this great, really low relapse rate, and you drill a little bit, you say, how did you figure that out? Well, it's 6 months post-treatment, we make phone calls to everybody who was discharged, and we ask them these 3 questions, how are you doing? How do you feel? And have you relapsed? And everybody's going to say, pretty well, great. And no, of course I haven't relapsed. Right? So what does that mean? It means nothing, right? So find rigorous ways to do the measurement, team up with some clinical outcomes management company. And to give a shout out, Parker, to you and your team, as you know, one of my big bugaboos is compliance, right? And so especially in the SUD sector, and to a limited extent in the mental health one, compliance is increasingly important, and almost nobody, not almost nobody, but very, very few folks pay attention to it in a rigorous way. So again, back to culture, when I look at culture, I want to see an achievement culture and a culture of compliance in a company. Now, I ranted off there, Parker. Did I really answer your question?
You were right on point, and I couldn't agree more. It's been really nice this year at both BHB Invest and at TCIV, that there started to be more of a focus around compliance as it relates to mergers and acquisitions. There has not been enough of this conversation, but it's an important one to have, because as we talk about the reshuffling of the deck, and as things evolve over the course of time in our industry, compliance is now much more of a kind of real and tangible business activity that owner operators have to focus and think about. Jonathan recently gave a talk on a panel at the Treatment Center Investor Evaluation Retreat on compliance, and it was amazing to see that there was actually a focus that was given towards this, and that a well-respected professional in our industry that knows it was able to speak on this point. And so On the thread, Jonathan, of leveraging technology and additional outside services like outcomes tracking management companies. I'm certain that these are some of the things that you're working with your customers on implementing as different tools, helping them find the right vendors and the right sources of technology. We've have mutual customers that use our Simplifiance platform for ongoing management of operations and compliance. So maybe you could speak a little bit more about the different tools and external services that are available in the marketplace, and how you at C4 and your team are working to leverage these kind of innovative tools and services to be able to maximize business value for the organizations that you work with.
Absolutely. And again, a great example is being able to take a tool like Simplifiance offers, and really I akin it to really having the Sears Craftsman tool chest, the really large 8-drawer one, because there's a lot of different tools within the system, but being able to have an organized methodology that gives people the ability to automate certain processes, to have really great information exchange, to have proper documentation, and then aggregation of all that data in very meaningful ways. Handy folks, and I know this is some of Parker's experience through our years, build their own spreadsheets and their own tracking mechanisms, to do things in very manually driven ways, and was part of the inspiration, for what you've built and grown and are sharing with the world. But there are those tools. A lot of folks, and I gave this example in that talk at TCIV, a lot of folks don't use the right revenue cycle management tools. Systems such as, Avaya, really are there designed to help, and they're only using 10% of the functionality. Will use electronic health record systems or electronic medical, record systems, but only really use about, 20 to 30% of the functionality. And they have different systems talking, CRM systems, and sales management systems not being integrated, and having, communication between the systems is really an issue that we end up discovering a lot of times, where people are sold a particular system because it serves one function of one person in an organization, but no one else has access to that information, and that information isn't shared. Helping people really understand the tools that they have, and then what's the right fit for them in terms of their strategy, to Dr. Vaccaro's point of how does that fit in the long run? How are we going to support the people to do the best work possible? So helping them define the tools that they need to be able to spend more time doing the work that they need. So within an organization, how do you help clinicians get more direct service time, with the person served and their family member? Within an operation, how does a director of operations get more time with their staff to be able to have more time to engage, deliver, and support them in those organizations, and really helping leadership understand in every domain of a business that there are tools for this, and that technology needs to be applied to its maximum capacity before you add new ones, right? Really see, how does it all fit together? And, does that technology that you saw at the conference, or that Jonathan mentioned during his talk, is that the right fit for you in the stage of growth? Because you may want it, you may need it, but culturally, how do you get that integrated where everyone's actually using it and you're getting the true value on the investment of the process? So with Simplifiance, I know as a matter of course that's really intentionally designed to be user friendly for folks, and that integration and adoption rate isn't as challenging as other systems when it comes to compliance. And I mentioned this in my talk as well, but the term that we use, Dr. Vaccaro, is oppositional compliance, right? That idea that I'm compliant because someone told me I have to be. But the true value, of it in regard to mergers and acquisitions is really being able to demonstrate the quality of care equal to quality of earnings, and not waiting till the sale to do so. And that's the tragedy for a lot of owners and operators, is they wait too long, and it's too late to be able to go back and aggregate that information. So those tools are really critical of being able to get in there, use them correctly, and so that you're avoiding the classic mistake of all you have is a hammer, so everything becomes a nail.
Wow. Yeah, that's powerful. And I think, you bring up some really valuable points, and I almost wish we had more time to unpack each of them. But like you had mentioned, the technology is there. Our industry is extremely slow to adopt. But it's not like we're waiting for innovation to happen before we can make changes to the way that these businesses operate. And unfortunately, I was in that position as the director of operations, that I was managing our compliance with spreadsheets and Google Forms and pen and paper. And it did take away from my time from the staff. And it did take away from my time, triaging certain issues with the parents of clients and so on and so forth. And that is why, large in part, that I did develop a very user-friendly platform that can save time and effort and give time back to be with the human beings, which is ultimately what at least the majority of us sign up for when we want to come work in behavioral healthcare. And then the second point that you made that I'd like to unpack and then transition into a question to Dr. Vaccaro is the implementation and the integration of technology, right? And that's ultimately where the rubber meets the road. You can have a full tool chain of technology. I've got Kipu, and I've got this outcomes tracking, and I've got Simplifiance, and I've got this billing, and I've got this other software, and I've got this other software. But if it's not being used effectively, then it's just a tool that's sitting there that's not effectively improving or fixing some of the things that you're going through. And so obviously, Dr. Vaccaro, as you're reviewing, targets and opportunities, you're looking at whatever kind of technological tool chain or different vendor suite that they have. But I assume that you're also trying to dig a little bit deeper into what kind of capabilities within the EHR are they using and maximizing?
Yeah.
Are they using something different than Excel to manage compliance? And what does that look like? And how does that roll up into a meaningful dashboard of data that can be used from a business intelligence standpoint? So if you could maybe just comment briefly, as you're looking out in the market and as you're evaluating programs for purchase, what are some of the things that you look at in relation to, technology and how they're using it either effectively or ineffectively?
Yeah, sure. Happy to do that. Yeah, so one of the things, as I mentioned, as an operating partner, that I look at the operations initially almost exclusively with the finance in the background, and I get to that. And from an operating point of view, I'm looking for what I said before, performance. I want to see results. And then as you drill deeper, so you start with, as you say, oh, you got a great EHR, you got a great financial package. Are you using them, right? And, one of my big bugaboos with EHRs is they're not just repositories of information. They shouldn't be. They should shape workflow, right? And all of the good ones have that ability, but I find that people check the box. They say, okay, I checked out these EHRs. I ground down the one I liked, into the ground with price. I'm going to do it, but none of them look and say, okay, let me look at my workflow and how that's going to change. Let me look at the reports that I pull out of these systems and how am I going to change people's behavior? Because that's what it's all about. Keeping people is, my father taught me 95% of people are well-intentioned, good people who want to do the right thing. The other 5% you ignore or vote for if you're so inclined. But for those 95%, they need information to get better, and so now I forgot the question, Parker. I'm rambling, and
No, that's okay. Just the use of technology applications and the effective use of different systems and technologies rather than just a tool chain of dormant systems.
Yeah. Well, and I'll give you an example in a company you and I worked with for a bit, Parker. When we implemented an outcomes management system, everybody checked the box, and the therapists all said, yes, 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 I'll do it. Didn't really do it. You finally got them to do it. When we held their feet to the fire and had them really use the outcome information with their patients, we found that outcomes improved. Patients were more satisfied. Therapists were happier because you were using the technology that we brought in a meaningful way to really improve care. And so that's, the caution I'd issue is, you check the box, get all the right systems in place, all the right workflows and everything, but then use them appropriately and manage. Don't assume you implemented something, I got Kipu and everybody got trained and everybody's going to do it. That's baloney. You have to make sure, you trust but verify, you get in, you use the reports and use those things that you've paid for, to their maximum advantage.
Very nice.
Sure.
Yeah, it's a very good point. I mean, it's very overwhelming at times to think about the integration of different tools that ultimately are purposed to help you out and have come to the marketplace to simplify the workflows. But I like how you framed it in terms of thinking through how your workflows are going to be affected and or improved, and then walking that back into a strategy of a purchasing decision. And we see, a lot of the uses of EHR being like, well, this is just what we do and why we have to do it. And so it's like this necessary evil.
Yep.
But the purpose is to make documentation less laborsome and to be able to measure things more objectively using the benefits of the tools and the technology. And so I
Yep.
think that the way that we as leaders are communicating how the technology is being used, both practically, but also in theoretically, is where you're going to really see the buy-in, or you're going to see the box checking, which is typically what we see more of, unfortunately. And so as we see different outcomes management tools, different compliance and operational tools come out, I think what's important for people to consider is the end game goal in using that application, and then the messaging from the top to the rest of the staff about how this is well intended behind helping them give them more time back to being with the patient and being with their peers as well. So a lot of meaningful discussion here. Would love to continue to let it go for another few hours, because I'm sure this group could keep it rolling. But I did want to leave some time here at the end for any questions, to do some Q&A for anybody from the audience that wants to throw something out there. I think that there's a direct message opportunity to get to Gina, or to the chat. So if anybody wants to ask any questions of anyone in this group or of all of us, now is a great time to send those in. I see that Nikki loves the oppositional compliance note there, Jonathan. I think that that's going to be repurposed dozens of times over. I hope you're okay with that. We're going to probably have to use that as well.
Full credit to my wife, who's a licensed marriage and family therapist, licensed professional counselor, licensed addiction therapist, who was applying for a license in another state and was procrastinating on some things and said, why am I being oppositional? I just want to be compliant. It's oppositional compliance. You talk about this all the time with your clients. And I said, we do. And it's helping people develop that culture of understanding that, quality and consistency are what compliance are about. And so shifting that message from have to do to want to do, right? So full credit to my wife for that.
Yeah. And even, furthermore, and we'll just kind of keep talking as we wait maybe for questions, is connecting, compliance, quality, and then value. Because, I think historically it's been very difficult to tangibly connect from an economic standpoint compliance with value, other than we kept our certificate of good standing, and therefore we're not losing our business or our contracts or what have you. So I kind of spoke on this on my panel at TCIV, that it used to just be, and kind of still in some ways is, a pass or fail when it comes to compliance. But when you go to the capital marketplace, it's a lot more of just a pass or fail. It's hey, we have a pretty rigorous report card of what we're looking for that may go well beyond what the regulators are looking for in audits that will either pass or fail you. So we do have one question that came in. The question is, when evaluating an organization for a merger or acquisition, what are some of the immediate red flags that would cause you to move on to another organization? And then alternatively, what might be some of the green lights? So I'm going to throw that one to you, Dr. Vaccaro. What are some of the immediate red flags that you start heading in the opposite direction of?
Whoa. Well, when you tell me you're in the top 5%, that always makes me raise my eyebrow. Well, one of my favorite ones, a finance colleague once told me that anytime you walk in a door with a company and they say, we have a different or unique or special approach to billing. And he said, when you hear that, the fraud flag goes up. So that's one. So if you think you've discovered something to build for services that nobody else has thought of, you're wrong. Just assume you're wrong and cut it out, because that's a red flag for sure. More red flags accrue as we start to look through data and we find, so if things don't get produced that we ask for, we say, okay, either they don't exist, which means they haven't been managing the way we would expect. So, KPIs, let me see them. I recently with a company got a speech about, we have a KPI dashboard. Blah, 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 blah. And we said, okay, great. So tell me, conversationally a little bit of what you look at. I look at, and they said all the right things. And I said, okay, can you make it live and get me into it so I can see it? Well, that'll be a little difficult. I said, okay, can I see some of the reports that are generated? We're in the middle of redoing that. Red flag, right? So if you're not living the achievement culture and have demonstrated proof, red flag. So those are the most obvious ones, and then obviously we can get into diligence and start looking, and some of the initial representations when you find that they're simply not true, profit being, one of the big ones. One of my favorites always is the add backs, so you get a category of things for the non-finance crowd in here. I'll tell it in a way that I understand it. Add backs are always ways to improve your profitability that everybody's going to scratch their heads at. And so it'll be like, well, we're going to sell you the company and we're going to add to our profit line these things that you're not going to pay for anymore. It's like, no. I just want to see a clean picture of what the organization is. So,
yeah, well, that's really nice. I think the important point that I pulled out of that is that anybody can say what they do is revolutionary, that it's special, that it's differentiated. Yep. But as we say in the compliance world, if it's not documented, it doesn't happen.
There you go.
So, this isn't a business development opportunity to share about, the narrative. That is an important part of the transaction, but you got to be able to back it up with data. That's and right. So, what we see oftentimes in the marketplace and what we work with, and Jonathan, I'll dovetail this into a question to you after my comment, is that there are a number of different important factors to be measuring and to be reviewing and to be discussing and to be able to show at the ready, whether it's during an M&A type of event or just on a quarterly basis internally with your team. So I think historically we've seen a lot of people having meaningful conversations without the sets of data and the dashboards to be able to back that up. And so, what I'll translate the question in over to you, Jonathan, is the second part of this question that got asked in is, what are some of the green lights that maybe help? And having been through some transactions yourself, what are some of those things that you've seen buyers really light up about and say, wow, well, you guys have demonstrated X, Y, Z. Therefore, we'd really like to make a compelling argument closer to that 8X rather than that 6.5.
Absolutely. And I'll dive right into the culture example. And a really granular one is organizations that annually do compensation analysis and correction systemically and can show that. For a buyer, that's really important because ultimately, if an owner operator's salary is, 15 to 20% above everyone else's, it means they've been taking their profit out of the business along the way. And it's going to hurt them in the long run. But the greater pain to their organization is they haven't been compensating their people correctly. So a buyer's going to need to come in, and in order to retain a large portion of the succession of the staff, make huge investments, right? And that's one of the, so when organizations do that well and have the documentation to show that they've, managed this in their performance improvement as a business, as a regular part of their strategy, it really speaks to a lot of other indicators within a business. It means that they're doing consistent employee evaluations. It means that they're valuing their people. It means that they understand that they can apply their revenue towards growth in areas. And so it's a real great KPI and really an OKR, an objective key result that says when you're doing these things consistently, buyers really appreciate that because it's a great indicator of a really well stabilized business that's employing a strategy, and it's the evidence to it. And it'll show up in the culture where, when a buyer walks in and talks to, a frontline staff member and said, oh yeah, no, in my performance evaluation, my supervisor and I had been working on these goals and I was able to get a raise as a result of it. It shows how the compliance measures in an organization are actually being employed. And so that's really attractive. And again, for buyers, especially with small to mid-sized organizations, when they see owners not overpaying themselves and paying themselves a good compensation, but not an overcompensation, it really says that someone's, excuse me, had the discipline to know how to invest in their business over time, and that this acquisition is really, it's a great investment for them because some of the hard work's already been done.
Yeah, I mean, you can't hide from overpaying yourself for years when you go to the table to try to sell.
That's
And
right.
I think that, you can demonstrate a lot of not only humility from an integrity standpoint, but also from a pure business standpoint, a show of strength when you come to the table and say, I've paid myself a fair wage and also to my team. And that although this may disrupt some of our culture to move through an acquisition, which is a concern of any purchaser of a business, we've taken such great care of them and we've built such a foundation of trust in our culture that they know that we wouldn't go sell to someone else who's going to chop it up for pieces and just kind of abuse the system that's been so thoughtfully and carefully crafted and created. So this has been an incredible conversation. I always love speaking with both of you, and it's awesome to have you guys both in the same room with me today. We will push this out for anyone that wasn't able to join live. These are the three organizations represented from the contributors today. Simplifiance is a complete solution for behavioral health compliance. We've got services and software to make licensing, accreditation, and day-to-day operations a much easier initiative for you to continue to do. And then also to position yourself very well for folks like Dr. Vaccaro and his colleagues. So if you're interested in seeking an investment in your business, if you're seeking to potentially exit your business or do a partial exit, Thrive Health or Sun Healthcare Capital is a great avenue to go to start the conversation. C4 Consulting and Jonathan DiCarlo, him and his team, are incredible about helping prepare organizations for a sale, whether it's next year, the year after, 5 years down the road. You can never really start too early in the process of strategy, in the process of being able to measure performance, knowing that you're going to have to demonstrate that. And then the unique and creative ways of looking about how you're engaging with your people and how you're attracting talent and retaining it, and measuring that in a substantial, objective way. So these are the ways that you can get in touch with the three groups that are represented today. And as always, thank you so much, Dr. Vaccaro, Jonathan, Gina for coordinating, and Chris Bennett for all of your hard work on the sidelines. We appreciate everybody coming today, and we'll see you next time.
Hey, and Parker, I just noticed on that slide my contact is wrong, so I just sent it on. So if you want to distribute it, that's fine. It's in the chat.
We'll make sure that we distribute the accurate email from you to everybody else.
Cool. Thanks.
Awesome.
Thank you so much.
Thank you so much, everyone.
All right, take care, everybody.
Bye-bye.